Hi, today I will be speaking about a project created by me that I called the Fabulous Foundation and is my final presentation for the class HSC 2648 instructed by Michael Hall. And throughout this project, I will talk about the community analyst, the health issues and behaviors, the organization, the program objectives, the theory, and the implementation. So first up is the community analyst, and my community consists of white single females through the ages 18 to 44 years old that have a college education and are making less than $25,000 a year that live in Broward County, Florida. Throughout my research, I discovered that the top 5 health issues as per county measure include overweight, obesity, arthritis, disability, and asthma. And in Broward County, it consists of 37.9% of the population, and in Florida in general is 37.6 with a difference of 0.3. For obesity ratings, in Broward County it is 27.1%, where in overall Florida is 27 with a difference of 0.1. And for arthritis, in Broward County it has 20.4% of the population, and in Florida it is 25.1 with a difference of negative 4.7. For those with disabilities, they consist of 15.8% of the population, whereas in Florida it's 16.2 with a difference of negative 0.4%. And lastly, the population with asthma is 13.9% for Broward County and 12.7% in Florida in general, with a difference of 1.5%. When comparing the health resources in Broward County to Florida in general, I discovered that the healthcare providers in Broward County tend to be higher than the state's resources in all aspects except for their EMTs and their licensed practical nurses, in which the state has an advantage over. When it came to the behavioral and mental health professionals, the county number of resources are all greater than the state's, and the facilities in Broward County tend to have a higher number of resources compared to Florida in general, but the state's resource number is greater than the county's in the following facilities: intensive residential treatment facilities, NICU, and level 2 beds, along with nursing homes and skilled nursing unit beds. So, with all that research being said, Broward County resources and Palm Beach County resources both have many strengths and weaknesses. Palm Beach County have 6 number 1 favorable quartile healthcare providers, while Broward County only have 9. On the other hand, both Broward County and Palm Beach County have all 5 of their behavioral and mental health professionals titled as number 1 favorability quartile, and this shows us that Broward County has a higher ranking for healthcare providers compared to Palm Beach County, but they both have excellent behavioral and mental health professionals. When it came to the facilities, Broward County has more acute care beds and hospital beds compared to Palm Beach County, but Palm Beach County offers more nursing home beds, which I think is more valuable because Florida has a large population of older citizens who eventually end up in nursing homes. So Palm Beach County and Broward County both have resources at hand that are necessary to provide for the residents that live in their communities. For collecting my data throughout my project, I would be using quantitative data points and qualitative data point. The quantitative data points would include the physical activity level along with the treatment plans, because being overweight or obese is easily changeable through a lifestyle change that surrounds itself with exercise. And I also believe that observing treatment plans could help all 5 of my health issues, especially arthritis and asthma, since these 2 are very ongoing conditions that need direct medication and attention. Although I think having correct treatment plan for obese, overweight, and disability would help these individuals as well because they have help offered to them. And then my qualitative data point would be the barriers that come along with committing to treatment plans. So, a question I would ask my population would be, what challenges do you face when it comes to sticking to your treatment plan? and this would be because understanding the patient's barriers can make it much easier to help them more. For example, if a barrier the patient is facing is a lack of social support, we could point them in the direction of a group of individuals who are all suffering from the exact health issue at hand. The way I would collect my quantitative data points would be through a survey, and the variable would be level of physical activity, and the participants would be directed to select how often they engage in physical activity, and their options would be A, 0 times a week, B, 1 to 3 times a week, C, 4 to 6 days a week, and D, 7 days a week. And through that, I would understand their physical activity level. When it came to their treatment plans, I would have the participants answer, are you currently taking medications regularly as prescribed from your doctor? To which they would then answer either A, very regular, B, somewhat regular, or C, not regular at all. And that would help me understand their barriers. And then for the qualitative data points, it would then again be another question asking them what barriers they face, and then through their answers, I would be able to point them in the direction throughout their program for them to get direct help. Next topic at hand is the health issues and the behaviors. So, with repeating the top 5 health issues of being overweight, obese, arthritis, disabilities, and asthmas. A behavior change that I believe that could help either of these health issues include being overweight. You could start exercising daily, and this behavior change would lead to a drop in weight. Obesity could be changed and managed by eating in a calorie deficit and incorporating healthy foods into the diet. This behavior change would lead to the individual losing weight and keeping it off for a long term. For those with arthritis, engaging in regular, consistent, low-impact physical activity could reduce the pain in their affected areas while also simultaneously strengthening their muscles, which leads to long-term effectiveness. For those with disabilities, when it comes to walking and climbing stairs, consistently using a handrail while walking up the stairs and by going one step at a time, these individuals with a disability could change this issue by implementing the behavior change of using the handrail. And lastly, those with asthma should be increasing their physical activity levels, because people with asthma, when you increase your fitness levels, it also strengthens your lung function, which ultimately enhances control of their asthma. The next section of my project talks about the organization, which includes my mission statement of the Fabulous Foundation is to empower these college-educated, underemployed single women in Broward County to achieve an economic freedom and professional fulfillment by finding the common ground between academic success and career growth through resources provided by our foundation, with the goal of improving the quality of life of young women in Broward County, because due to being economically reduced, they don't have access to healthy foods, which leads to overweight and obesity, and so on and so forth. When it came to choosing who would be in my committee for planning my project, I landed on the mayor of Broward County, the board of county commissioners, college graduates who are struggling with life after college, and single mothers. I landed on these groups of people because they are people who could either have the high status to make the change happen, or people who are selfishly wishing for the program's success. Because the mayor and the board of county commissioners have their high status within the community and have the power for the foundation to thrive. But on the other hand, the college graduates and single mothers are the members who selfishly want this project to thrive because of the benefit it would have on them and their personal lives. The next portion of my project spoke about the program objectives and how each port would make the foundation thrive in itself. So, the environmental objectives are the things around the participants that they need in order to thrive. So with research, by the start of my program, 70% of the participants in Broward County will report that they have access to gyms to incorporate exercise in their daily routine. Those who struggle with obesity will have access to affordable grocery stores to remove the food triggers and replace them with healthier options. The ones with arthritis will have access to gyms that tailor to the needs of arthritis patients, for example, like physical therapy options throughout the gyms. Those with the disability will have access to handrails on both sides of their staircase in their personal homes, and those with asthma will have access to controlled exercise environments that surround their inhaler. The learning objectives are the ones by the middle of the program. 90% of the participants in Broward County will be able to report that they've learned. The overweight will be able to report that they've learned to track their progress and control their eating habits. The obesity population will be able to learn how to cook healthy recipes in the comfort of their own home. The arthritis population will learn the benefits of exercising daily to have on their bones. Those with disabilities will learn the positive impacts that handrails have with people with the disability. And lastly, those with asthma will learn that exercises can and will improve their lung function and ultimately help them in the long run with struggling with their asthma. And lastly, the behavioral objectives are the objectives by the end of the program. Shows us that 70% of the participants in Broward County will report that they are overweight people are actively engaging in physical activity every single day for 30 minutes. The obesity population is eating in a calorie deficit with healthy foods. The arthritis population is engaging in regularly, consistent, low-impact physical activity. The disability population are using handrails while going up the stairs, and the asthma community is increasing their physical activity levels. Next up in my project is the theory. The next portion of my project dives into the overview and the utilization of the health belief model, which is a value expectancy theory that was developed by a group of psychologists at the United States Public Health Service during the 1950s in hopes to explain why people would or wouldn't use health services. Throughout this model, they discovered that there were 6 constructs that made it work. That includes the perceived susceptibility, perceived severity, perceived benefits, perceived barriers, the cues to action, and self-efficiency. The perceived susceptibility is the individual's belief about the risk of getting a health condition. The perceived severity is the belief of the seriousness of the threat at hand. The perceived benefits is the belief of the positive outcomes of taking action. And the perceived barriers are the obstacles into taking that action. The cues to action are the factors that make someone take the action, and the self-efficiency is the person's confidence in their ability to successfully take action. So for my overweight population, the perceived susceptibility would be the individual thinking that they are at risk of diabetes or other health issues that are associated with being overweight. The perceived severity would be the individuals believing that the health problems that come along with being overweight are very serious. The perceived benefits would be the individual believing that starting to exercise daily would have a positive effect on the health issue at hand. The perceived barriers would be the individual's obstacles that they face when they start to exercise daily, and this would include thinking exercise is way too hard or that they don't have enough time for it. The cues to action would be the factors that trigger the individual taking the action, and this is a common example would be a doctor recommending that weight loss is necessarily because their health is at risk because of their weight. And lastly, the self-efficiency would be the individual's confidence in their ability to successfully start and actually sticking to exercising daily. Next up through my project would be the implementation, and that surrounds the marketing and the 4 P's that are the product, the price, the place, and the promotion. For my priority population of the young women struggling, the product would include a gym membership. The price would be $29.99 per month. The place would be an LA Fitness, and the promotions that I would take to promote it would be signs around local towns throughout Broward County, flyers in stores and on campuses, social media advertisement, and all things that promote LA fitness gyms and the exercise equipment and classes that those would gain from getting a membership there. The next topic of my project would be the program activities and the resources. For the environmental change throughout my population would be including access to gyms to incorporate exercise into their daily routine, along with access to grocery stores to remove the food triggers and replace them with healthy options, the access to gyms that tailor the needs of arthritis patients, also access to installation of handrails on both sides of staircases in those homes with disabilities, and lastly, access to controlled exercise environments with their inhaler for those with asthma, all of which correspond with getting a gym membership and the resources needed that come along with the exact needs of the population at hand. Next up would be the learning options of my program, and this would be tracking their progress and control their eating habits for those that are overweight, along with the obesity population, teaching themselves healthy recipes to cook at home, where the arthritis population would be becoming aware of benefits of exercising daily, and the disability population would be educating themselves on the positive impacts handrails have with the people with disabilities. And lastly, the asthma population would be learning why exercising daily can and will improve their lung function, and all of which require a gym membership, Whole Foods, recipe books, etc., a meeting room to educate my participants. And lastly, the behavior change for my population would be engaging in physical activity, eating in calorie deficits, implementing healthy foods into their diets, engaging in low-impact physical activity for those with arthritis. Those with disabilities will be using handrails while going up the stairs, and the asthma population will be increasing their physical activity that corresponds with increasing their lung function ability, and all of which need resources like including a gym, instructors that guide fitness classes, calendars to track calorie intakes, doctors that are educated and licensed to practice on those with arthritis and asthma, and lastly, handrails from local stores and workers to install them in the population with disabilities and struggle with climbing upstairs. And lastly, the grant that I researched for my program is through the National Institutes of Health, and the grant itself is called Nutrition Obesity Research Centers, or for short, NORCs, and this is a $3.6 million grant that will be launching research centers that focus solely on obesity rates going up in the world, and I believe that this would be perfect for my priority population because all of my health issues surround the population that is overweight or obese or just need ways to implement daily activity into their lives and healthy eating habits into their everyday lives as well. This is my reference page. Thank you.